Jennifer Hernandez, Loan with Jen. So I have here today Dr. Okoye. She is a direct primary care physician, and I've gotten to know Dr. Okoye. She is here in Katy, and we live in Katy, and I know several people that have been using her services and even referred her to some. And I really want you guys to understand what direct primary care is. If you don't have insurance, or know someone that doesn't have insurance, or you have health insurance, but it's not comprehensive enough, that is what direct primary care possibly could help you. So, Dr. Okoye, thank you for being here today.
Thank you. Thank you for having me.
Yeah, for sure. So tell me the story of how you decided not to go into regular mainstream insurance and you wanted to be in direct, like what led you to be a direct primary care physician?
Yeah, that's a great question. So, I started practicing in 2008 after I finished my residency training, and I've pretty much worked all over Houston, done several different things, and everywhere I went, it was basically the same problems. Patients feeling like they weren't getting the kind of care they deserved, not being heard by their doctors, cost of care being such an issue, being very expensive. And it was like this burden, like if you didn't have insurance, people treated you as if you had a disease, really, which is sad, right? Like, why should healthcare be connected to insurance? So when I decided that I wanted to start my own practice, I knew I had to do something different. I really did. And when I first learned about direct primary care, it was like, oh, wow, this is a solution for patients and a solution for doctors. So it was a no-brainer, and I started the practice, and it's just been great ever since. I think it's an awesome model.
So what direct primary care does is it charges a flat fee, which is very reasonable. That's a monthly fee that you pay.
Yes.
And people would have access to their direct primary care physician on the weekends. You do Zoom with people sometimes,
Yes.
Sometimes there's, instead of going to the urgent care, there's clinics I know around town where you can go and you pay like $150 and they do the basics, but they're not someone who's like constantly knowing your history.
Right. Exactly. So yes, just what you said. Direct primary care, it's a relationship between the patient and the physician, and we take insurance out of it. So all the patients pay a monthly membership fee to be members of the practice. And when they pay that fee, they can be seen as often as they need to with no copays. So, whether the patients has to be seen 100 times a month, honestly, it doesn't matter. Doesn't matter. And we do office visits, we do video visits. All the members are able to reach me directly through an app that they can text me. So it's really a great option for patients who just want to know that they have access, and it doesn't matter whether they have insurance or not. This model works. Yeah.
So what happens when someone needs something more specialized? Like, let's say someone has cancer or they need some more special, like, what do you help them find at that point?
Yes, no, that's a good question. So, direct primary care is not insurance. I want to make that clear. It is primary care, which is, the things that we do to keep you healthy. So now, if someone needs something more specialized, if they don't have insurance, we will try to work and find them specialists that normally provide specialist care at affordable prices. So I have a network of specialists that I work with who provide reasonable cash price options. So yeah. Now, for the patients who have insurance or decide to get insurance, because I also still recommend that patients have insurance, especially if you're above a certain age, and you have certain medical problems. Then a lot of times they are able to pair direct primary care with a very high deductible plan that can cover them if they get, admitted to the hospital or have a major diagnosis. So you can combine the two, a really high deductible plan or even a health share to cover you in case of something major. So that makes everything more affordable, as opposed to trying to buy insurance on your own. Uh, you know, Trying to buy regular deductible insurance, if you know what I mean.
Mhm.
So
Yeah, I mean, the price is super affordable. Like when I heard you say how much it is, I mean, it's like very affordable. So that makes sense. So
yes.
you could get I have insurance with my employer.
Hmm.
If I get a super, super high deductible, because every time I go to a doctor visit, it's like $20 copay.
Hmm.
And an emergency visit is like 200. So
Right.
if someone has an emergency, like let's say I have some kind of weird something happen over the weekend,
Hmm.
I could, instead of going to the emergency room and waiting for 5 hours, I could
Right.
go I mean, you do as much as you can
Oh
without
yeah.
needing, breathing machine or something.
Oh, right, of course. Yeah, absolutely. And yeah, just what you said about the pricing. So at this practice, the membership fee costs between 50 and $125 a month. Is based on age. So it's really very affordable, So and yes, the way this model works, because we're not seeing 30 patients a day where we're bringing people in all the time, we actually have a lot more time to take care of people. So a lot of my patients are well taken care of, so things don't get so bad to the point where they have to go to the emergency room. You see what I mean?
Yeah.
Like
Yeah, no, I understand.
those trips to the ER because your blood pressure is uncontrolled, because you haven't been able to get in to see your doctor. Well, with this model, we will see you so often, you'll be sick of me, because you get access before the illness even starts. We've already addressed it. Let me put it that way.
So
So
if people are watching this, because I'm going to send it to my friends and sphere that might not be in Houston. So you're in Katy, your practice is in Katy. So if someone is outside of that immediate area and they're in their area and they're like, well, I want to check out a direct primary care person in my area, what's the best way? Do they just Google direct primary care?
yes, they can. Yes. And one thing I also want to point out is that even though I'm in Katy, I have a lot of patients that come from Houston. So if when it comes to care, I know that people are willing to drive.
Yes.
And also with this model, because our patients can text us and can do video visits, there are a lot of things we can take care of where you don't have to come in, you see? So,
yeah.
In fact, for instance, I have patients who are truck drivers who are always on the road. And, if they have a UTI or something, wherever they are in another part of the country, they send me a message. If it's something that requires that I see them, we hop on Zoom, or we do a video visit, and I send a prescription. So yeah, it doesn't mean you have to drive to the clinic all the time. There's a lot we can do remotely. But then, of course, if you do need to be seen, we'll ask that you come in to the office. Yeah.
Yeah, for sure.
Mm-hmm.
Well, that is really great. I really want to get this message out to people that we know that might themselves or have loved ones that, not having insurance is a scary thing. And I actually referred you to someone that's dear to me that didn't have it. And she is so grateful every time I see her, because she was just avoiding and she was putting off things that she needed to do.
Right.
And now she feels so much more empowered that she's getting some things under control.
Right.
So I really appreciate that. And you're really taking care of her. But so direct primary care is what it's called. And there are options out there for people that don't have insurance to be able to get proper care. So, well, thank you so much for coming on today. Is there anything else that you want people to know before we go?
I think you covered most of it. It's a pleasure being here. Yeah, if people want more information, they can go to my website, katyppc.com. So Katy Premier Primary Care. PPC.
Yeah, and I'll put it as a banner here on the video too when we send it out. So perfect. Well, thank you so much, Dr. Okoye. It's good to see you always. And
it's
we'll
a
talk
pleasure.
to you soon.
All right. Thank you. Bye-bye.
Bye-bye.